From KETK, you're watching East Texas Live.
Welcome back. It's Medical Monday, and today we're talking about a condition that affects nearly 3 million Americans, inflammatory bowel disease, or IBD. And joining us now is Dr. Annie Lynn, a GI doctor with the UT Health East Texas Physicians. Thank you so much for being here today.
It's my pleasure. Good morning, David. Thanks for having me here.
Yes, ma'am. So first, let's talk about the basics. What is IBD?
IBD stands for Inflammatory Bowel Disease, and the two main types of IBD are Crohn's disease and ulcerative colitis. Both diseases cause chronic inflammation in the GI tract that can lead to very bothersome symptoms as well as serious consequences. However, the two diseases differ in what areas of the bowel are involved as well as what layers of the intestines are affected.
Yes, ma'am. What kind of symptoms should people kind of watch out for?
Common symptoms of IBD include chronic fatigue, chronic diarrhea, abdominal pain, cramping, blood in the stool, and also unintentional weight loss if it's going on for a long time. A lot of patients also have the symptoms outside of the intestines, such as joint pain, certain skin lesions, and eye inflammation.
Yes, I mean, how does IBD kind of affect the daily life?
It can be extremely disruptive. A lot of IBD patients have to plan their days and their lives around always being, always being close to a bathroom. The pain and the fatigue can also cause a lot of negative impact on work life, social life, and sexual function. And many people have to even cancel things like trips, outings, or other things they would have enjoyed if it weren't for their symptoms. Mental health complications such as depression and anxiety can also be very common among IBD patients.
Yes, ma'am. And so what kind of treatments are out there that are available?
There's unfortunately no cure for IBD, but there are plenty of treatment options now to help to combat symptoms and manage the inflammation, such as anti-inflammatory drugs, immunosuppressants, and biologics. We are involved in clinical trials as well to deliver new types of emerging therapy to patients who are interested. However, sometimes IBD does require surgery to treat.
Yes, ma'am. And so how important is early diagnosis?
It's extremely important because early diagnosis leads to early treatment, which will help to prevent complications such as stricturing, fistula, need for surgery, and even colon cancer. And so anyone with digestive system symptoms should consult a doctor to see if they need to be checked out.
Yes, ma'am. And so for people in East Texas that with IBD who are looking to establish care with a new physician, what are some things that you would like them to know about your practice?
Yes, I'd like to highlight several aspects of my clinic that will help put IBD patients at an advantage when tackling their diseases. First of all, we do have an infusion center on site where patients receive their infusion medications under the careful monitoring of an experienced infusion nurse. Even though IBD medications are proven to be extremely safe, there is a rare possibility of complications such as infusion reactions, and so it is safest to receive an infusion medication at a hospital where the highest level of care would be available if needed. We are also part of the 340B pricing program. It's a federal initiative that helps to provide medications at a significantly discounted cost to patients who are eligible. Additionally, we are a clinical site for IBD research, and so any patient who is interested and eligible to participate in a clinical trial may receive tomorrow's therapy today. And also, in addition to receiving cutting-edge medical therapy, our patients do have expedited access to a multidisciplinary team of providers, such as behavioral health specialists, dietitian, and surgeons to complement their care. And lastly, we do have a dedicated IBD nurse coordinator, and all our patients will have direct access to her if they have any questions or need to reach their providers.
All right. Well, thank you so much for coming in.
You're welcome. Thanks for having me, and thanks for helping to spread awareness.
Yes, ma'am. For more information, go to the website right there on your screen.